Okay, today I'm going to talk about something that's literally a pain in the ass. Yep, I'm going to talk about hemorrhoids. A lot of people don't want to talk about hemorrhoids, kind of an embarrassing condition, but it shouldn't be because hemorrhoids are just a part of the body. What hemorrhoids really are, at their most basic, are varicose veins in your anus, or to put it colloquially, your asshole. Pardon my French. But hemorrhoids they occur when the veins around the anus become swollen, and there's several causes. I'm going to get into that, but the about 50% of adults experience hemorrhoids by the age of 50. It's very common. A lot of it has to do with gravity, but more important than anything is sitting. I did an article in my Applied Metabolics a while ago. In fact, I think it was just published, recent issue about the health effects of extended sitting. And I'm not sure if I mentioned it in the article, but one of the effects of sitting on your butt for a long time, and a lot of people do this. Some people do this thing where they watch, what do they call it? I can't remember the term. Well, they'll watch entire series on Netflix or something like that, hours and hours of watching this. Others sit for hours playing video games. This is putting a lot of pressure on the vascular structures in your behind. The and what happens is they can get inflamed and swollen, and that's hemorrhoids. Hemorrhoids can either be internal or external. The internal hemorrhoids develop within the anus or rectum, while external hemorrhoids develop outside. Hemorrhoids are also known as piles. External hemorrhoids are the most common and most troublesome. They can cause pain, severe itching, and difficulty sitting, but they are treatable. The symptoms of hemorrhoids can include, well, for internal hemorrhoids, usually you'll see blood in the toilet, something like that on the tissue paper, skin that sticks out of the anus during bowel movements. External hemorrhoid symptoms include extreme itching around the anus, uncomfortable lumps or swelling near the anus, aches and pain around the anus, especially when sitting. Hemorrhoids often don't cause pain, but sometimes external hemorrhoids can form a blood clot. That's known as a thrombosed hemorrhoid. Internal hemorrhoids can also prolapse. That means they won't go back into the anus. They kind of stick out. Both prolapse and thrombus hemorrhoids can cause much more pain. They're very, very painful. The only thing that I can think of in that area that's more painful than those kind of hemorrhoids are something called an anal fissure, which is the anal sphincter muscle. You get splits or little cracks in there, which actually the same things that cause an anal fissure also can cause hemorrhoids, and that's straining at bowel movements and putting too much pressure down there. You have to experience anal fissures to realize the extent of pain. Every time you go to the bathroom, it's a exercise in sheer torture. It feels like somebody's taken a 14-inch sharp dagger and sticking it up your ass and twisting it around. I know that sounds gross, but that's anyone who can tell you that's what an anal fissure feels like. It's very painful, and there's some treatments I haven't looked at in years, but the treatments years ago were not great. One of them was to put nitroglycerin ointment, which would immediately dilate the anal sphincter. This is for anal fissure, and it would stop the pain. But the problem is that because of the nitroglycerin, which stimulates nitric oxide, you'd get within about 20 minutes, you'd get a headache, the mother of all headaches. It would feel like your head was going to explode. But today we're talking about hemorrhoids. But like I say, anal fissures are kind of related because what causes anal fissures is the same thing that causes hemorrhoids. But hemorrhoids they're not life-threatening, and a lot of times they'll just go away on their own, especially if you know the correct treatments, the way to handle it. If you're having a lot of bleeding or you see a lot of blood, you should see a doctor. But the bleeding could be caused by the other things besides hemorrhoids, including colon cancer, or ulcers. Black stools could be, that's from blood up in the higher up in the gastrointestinal tract. That could be a bleeding ulcer. This is serious stuff. You got to see a doctor right away. Now, what are the causes and risk factors of hemorrhoids? It occurs, as I said, the main cause is just too much pressure on the veins around the anus. Possible cause and risk factors include, this is the number one by far, straining during a bowel movement. In other words, put it simply, constipation. Constipation is the number one cause of hemorrhoids. And if you sit a long periods, like I said, sitting, especially sitting on a toilet, a lot of people have the habit. I'm sure some of the people listening or looking at this video, I'm sure some of you do this. When they sit on the toilet, they like to read. They like to take a book or a magazine or something, or maybe their phone and whatever, and they'll sit there for extended times. Unfortunately, sitting on the toilet like that for a long time, you're putting a lot of pressure on the vasculature down there, and you're kind of pushing yourself towards having a hemorrhoid develop. Even diarrhea can cause hemorrhoids. A family history, if you have close relatives that have had hemorrhoids, then you're more prone to it. It's an increased risk factor. Consistently living heavy objects that put a strain, especially in the lower body, can cause hemorrhoids. Now, this brings up a question, to anyone. I'm sure a lot of people watching this are involved in weight training, resistance exercise. The obvious question is, what about doing leg training, such as squats? You're putting a lot of pressure down there. No, squats, leg exercises, that kind of stuff, they will not cause hemorrhoids, because the bulk of the pressure, rather than being put on the anal vasculature, is being put on the muscles, and the hip muscles, the leg muscles. There's surprisingly little strain on the anal vasculature. As a fact, I've seen some scientific literature indicating that doing leg training actually helps to prevent hemorrhoids rather than promote it. Being obese, having a lot of body fat, will put more pressure on the vasculature. Doing certain sexual practices, I'll let you guess what that is. Also can irritate hemorrhoids and cause them to hurt. Being pregnant, because the enlarged uterus presses on the colon, causing it to bulge, and that puts more pressure on the anal vasculature. And just being over the age of 50, I would estimate that about 8 out of 10 people who are walking around over the age of 50 experience hemorrhoids at some time in their life. One reason for that, and I think that this is a huge risk factor, is not enough dietary fiber. If you don't take fiber, you're going to probably get, especially if you combine a lack of dietary fiber with not enough fluid intake, not enough hydrate, you get hard stools, which are hard to pass. They irritate the vasculature. They cause hemorrhoids. The fiber softens the stools and allows more easier passage. Doesn't irritate the vascular. So the most important thing you could do to prevent hemorrhoids is to ensure that you take a good amount of dietary fiber. That's in fruits, vegetables, legumes, that type of thing. If you don't like to eat a lot of fruits and vegetables, like me, I'm not big on fruits and vegetables. I just never developed a taste for them. I eat some fruits and vegetables, but not enough to meet the minimal daily requirement of dietary fiber, which is minimal 30 grams a day. So I take a couple of fiber supplements. Psyllium seed powder is an excellent one. Pectin, powdered pectin from apples, another great source of dietary fiber. They have something called hydrolyzed guar gum. These things are not only great sources of fiber, but because they are sources of soluble fiber, they also nourish the intestinal microbiome, which I've discussed many times in past videos and in my Applied Metabolics publication. Maintaining the health of the microbiome is one of the most important things you could do if you want to live a longer and healthier life and avoid disease. I'm not going to go into how hemorrhoids are diagnosed. That's a little bit not needed to go into, but how do you treat it? All right. The good thing about hemorrhoids is that most of the treatments you could do yourself. You don't have to go to an emergency room unless it's a lot of bleeding, or you're in severe pain. You might have a blood clot that's thrombosing or something like that. But most of the time, you could undergo home treatment. One really good way is what they call a sitz bath. That involves soaking it in a warm tub of water for 10 to 15 minutes. Now, you can increase the efficiency of sitz baths. Again, sitz bath is nothing more than sitting in in some warm water in the bathtub, enough to, get down there. But if you add about 2 cups of Epsom salt is a form of magnesium that it makes increases the efficiency of sitz baths probably at least 50%. It's very, 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 very great at relieving pain from either an anal fissure or hemorrhoids. It works almost instantly. Now, sometimes if you want to use, they have over-the-counter medications, suppositories, ointments. Examples of that include they have lidocaine, which is a local anesthetic. They have a couple of creams and ointments you could put down there. It'll block the pain. They have hydrocortisone over the counter. That'll reduce some of the inflammation, might help with some of the pain. There's a lot of so-called hemorrhoidal creams and ointments. I've seen a lot of them on Amazon. My personal opinion is most of them don't work very well. Some people like Preparation H. That works for some people, doesn't work for a lot of other people. So I mentioned the fiber supplements. Witch hazel. Witch hazel is another thing that kind of shrinks the blood vessels, helps to relieve some of the pain. As I said, the sitz baths, 10 to 15 minutes a day. If you have hemorrhoids, they recommend doing it 2 to 3 times a day. I don't know. To me, that's kind of time consuming. To sit in a tub for 15 minutes 3 times a day, you got to have a lot of time on your hands. Another way is actually putting ice, using a thin cloth or maybe paper towel, applying ice directly to the hemorrhoids, literally sticking it up your butt, not inside the butt, but on the outside. The ice is a natural anesthetic. If you hold it on the hemorrhoids for about 10 to 15 minutes, it'll relieve the pain almost as well as the sitz bath. So you could do that if you don't have time to take a sitz bath. I'm not going to go into the medical procedures, but sometimes they have the medical procedures will include something called rubber band ligation, where they tie off the blood vessel, the inflamed blood vessel that kind of falls off. And then there's something where they inject a solution in the inflamed vein. It's called sclerotherapy, and that'll also cause the hemorrhoid to greatly reduce in size. So the two take-home things, the best ways to prevent hemorrhoids, the easiest way is to make sure you drink enough fluid to avoid constipation and eat at least 30 grams of fiber. Food sources of fiber include whole wheat, oatmeal, pears, carrots, buckwheat, bran, and of course fruits and vegetables. Now, what else can I say? I really think that's about it, really. I think that covers it. But if you follow these procedures, especially the fiber and the water, and by the way, I have come across bodybuilders, and that was one of the reasons that motivated me to do this particular video, is that I've actually, especially when I used to cover contests for the bodybuilding magazines, most of which are now extinct, I've actually come across bodybuilders who actually had to drop out of competition. They trained for months for competition, but at the last minute, let's say, right before a prejudging or right after a prejudging, they will get severe constipation, or they'll have inflamed hemorrhoids with so much pain that they've had to drop out of the contest. This is after months of dieting and training, so it can affect you. And The reason these bodybuilders got that is because they followed cutting diets or diets to lose body fat that were literally devoid of fiber. And they also, the reason why it flared up, let's say the day or so before the contest, was because they restricted their fluids. The combination of no dietary fiber and severe fluid restriction caused them to get severe constipation, which irritated, either irritated the veins down there and caused severe hemorrhoid pain, or just the constipation itself was extremely painful. So that's one of the reasons that motivate, because I know a lot of people follow these diets, like the carnivore diet, for example, which is literally devoid of fiber. It has low to no fiber. It focuses on high protein foods. It's a great diet for losing body fat. It's kind of like a semi-ketogenic diet, but if you stay in it long enough, you're going to get hemorrhoids, for sure. You're going to get hemorrhoids because of the lack of fiber, and there's no restriction on fluid, except fluids that contain carbohydrate on a carnivore. But the thing is, it does restrict foods that are high in fiber. So developing hemorrhoids is almost inevitable on a carnivore diet. You will develop hemorrhoids on a carnivore diet because of the lack of dietary fiber. So I'll end it here by saying that. And I know it's a little bit of an embarrassing topic, hemorrhoids. It shouldn't be. It's just a normal part of the body. But, it's so easily avoided. It's almost pathetic that people will develop it because, again, don't sit on a toilet too long. Don't sit down on your ass without moving for hours, and make sure you ingest enough dietary fiber, and never restrict fluids. Never. There's no reason to ever restrict fluids. If you do that, you should avoid the developing hemorrhoids, and even worse, developing anal fissures, which is they've compared it to passing kidney stones. It's horrible. Anyway, that's about it. If you want more information on nutrition, exercise science, anti-aging research, hormone therapy, supplement science, including which ones work and which ones don't. I'm not associated with any supplement company, and I'm not going to ever push shitty, useless products such as greens powder. Probably the biggest ripoff in the entire supplement world are greens powder. I keep mentioning this because it's pathetic. So many people are influenced to buy that shit by these so-called influencers, people who have advanced degrees that are paid literally hundreds of thousands of dollars by these big greens companies to push their crap product. Don't buy it. Don't listen to these guys. They've sacrificed their integrity. In fact, I won't even watch myself. I will never read anything or watch anything, videos posted by these people. I'm not going to mention names, but you know who they are. They have huge followings. I won't watch their stuff because, in my mind, they have no integrity at all. I won't listen to them because I don't believe them. They're dishonest people. So, but you won't find that Applied Metabolics is 100% honest truth. It's also based on my over 60 years of experience and constant study, which I don't think could be matched by any digital publication on the entire internet. When you subscribe, send me a email, and I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information, brand new information on nutrition, exercise, and general health and medicine. Also, I have an email portal on my Applied Metabolics webpage, where current subscribers only can send me short questions about anything they read in Applied Metabolics or anything they're curious about when it comes to nutrition, exercise science, or general health. And I will answer their question as a bonus or appreciation for their subscription to Applied Metabolics. So obviously, this offer only applies to current subscribers of Applied Metabolics. Other unsolicited questions, I'm sorry, I don't have time to answer. So I go out of my way to answer people who support my work. As far as I know, I think I'm the only person, I could be wrong about this, but I think I'm the only person who has a publication like this who personally answers questions. These other people will not do that. So I'm only going to do it for my subscribers. If you think this YouTube channel has any benefit for you, please, by all means, subscribe to this channel. It's completely free. Oh, I should tell you my Applied Metabolics. It's at www.appliedmetabolics.com. And this channel, of course, you know where it is if you're watching it. It's completely free. I post a new video every Tuesday. I'm open to suggestions. If you have a suggestion for any particular topic that you want me to cover, just leave your suggestion in the comments. And if I feel that your suggestion will be of interest to a large number of people, I'll do a video on it. And then the video will be 100% truthful, not trying to sell you anything. That goes for Applied Metabolics and my videos. Completely non-commercial, 100% evidence-based truth. So you subscribe to Applied Metabolics and subscribe to my channel. I guess I always hear people say put a like under the video. I don't know if that helps, but if it helps, please put a like. I don't know whether that really does anything, but I heard it increases the algorithm. Again, I'm not sure whether that does much at all, but please put a like. Check this, like a little box or something you could check. But anyway, if you other than that, if you want to have the best friend you'll ever have, go to your local shelter and adopt a dog. Thank you for listening.